Hey guys, welcome back to my YouTube channel. I thought that in this video we can go through some internal medicine practice questions together. So let's get started. What I first like to do is read the last line of the paragraph in order to prime myself to what the question wants from me. So let's read it together. Which of the following recommendations is most appropriate? And this is the only highlighting I do when I'm reading a question. I only highlight what they want from me in the last sentence. Because if I highlight too much, then I am now getting lost in the sauce, and I'm only re-looking at what I highlighted rather than focusing on all of the pertinent positives and negatives. So let's read it. Which of the following recommendations is most appropriate to prevent a recurrence of this patient's symptoms in the future? So we want a recommendation that is most appropriate. That's what we're looking for. So now we can jump in and read the vignette. A 23-year-old man presents to the ED with a 6-hour history of rash on his neck and back. He noticed some reddening of the skin on his back the previous evening, which turned into a blistering red rash overnight. He was surfing the previous day, spent many hours at the beach. He applied at least 1 ounce of water-resistant SPF 30 sunscreen 30 minutes before leaving his home. Vitals are normal. Physical examination reveals erythema of the skin over the upper back and dorsum of the neck with 3 vesicles filled with clear fluid. The affected area is edematous and tender to touch. And now we want to know what is the most appropriate. So first we want to kind of consolidate all of these symptoms that we're seeing and the history that the patient gave us in order to understand what the main diagnosis is. So this looks like a severe case of sunburn because you have the edema, you have the erythema, and you also have the vesicular rash. And he did apply the sunscreen, but he was out for 5 hours, and it looks like he only applied it once. And it also says that he was surfing, so he was in the water. So our diagnosis that we're working with right now is sunburn. So now let's look through the answer choices and see what would be appropriate to make sure that he doesn't get sunburn like this again. So A, only go outside on cloudy days. So this doesn't really make sense because even if it is cloudy outside, the sun's rays can still deliver like the UV rays into the skin. So that's why it's actually important to wear sunscreen even on cloudy days. Apply sunscreen directly before getting into the water. So this could be helpful, so let's just keep that into our consideration. The next one, C, apply at least 3 ounces of sunscreen. I don't think this would have made a difference because he already applied sunscreen and he still had symptoms. So I don't think that applying more sunscreen would have made much of a difference. Use waterproof sunscreen. Well, he was in the water, which could explain why he was being affected even though he was wearing sunscreen. However, it says right here in the vignette that he was wearing water resistant. So using waterproof sunscreen next time probably wouldn't make a difference because he was using water resistant SPF this time. Use SPF of 50. This also looks like it would make sense, so let's keep it into the consideration. And now let's look at the last answer choice. Reapply sunscreen after water exposure. So this one actually looks correct to me. It makes the most sense to me because in the vignette it says that our patient only applied sunscreen once, 30 minutes before leaving his home, and then he spent 5 full hours at the beach and he was in the water. So he was not reapplying his sunscreen, so it probably wore off in the 5 hours that he was at the beach, which is why he's presenting with these symptoms, very typical telltale signs of sunburn. So I think this answer makes more sense than B or E that we have remaining because doing either of these would not really matter if the patient is not reapplying the sunscreen every few hours or at least after every water exposure. So I think F would be the answer choice that would really make the difference next time. And we are right. To provide adequate protection against sunburn, sunscreen with an adequate SPF should be applied at least 30 minutes prior to sun exposure. and again after each exposure to water or after sweating. The sunburn is likely due to the fact that he did not reapply sunscreen at any point. So that's kind of the line of reasoning that we were going for too. Let's move on to the next question. So once again, we're going to start from the last line. Which of the following is the most appropriate recommendation? Okay, now let's read the vignette. 61-year-old male, examination of progressive left hip pain. He was diagnosed with osteoarthritis. He's had an 18-pound weight loss after changing diet. Pain worsens when he climbs stairs, which makes it increasingly difficult for him to reach his apartment. He's been using diclofenac intake more, but says that it does not provide complete pain relief. And diclofenac is basically a strong NSAID. He asks for a treatment that will lead to long-term improvement. His only other medication is pantoprazole. He does not smoke or have any alcohol history. The left hip reveals crepitus, limited internal rotation, and pain with full flexion and extensions. Radiographs of the left hip reveal joint space narrowing, osteophytes, and subchondral sclerosis and cysts. Now, these osteophytes and the joint narrowing, these are classic signs of osteoarthritis on the radiograph. So now we want to see what the most appropriate recommendation for this patient is. So, because he has been taking a strong NSAID such as diclofenac and it hasn't been helping the pain, I don't think that doing something like a fentanyl patch or additional glucocorticoid injections would really help with the movement or any of that, because the patient already did and is already doing regular swimming and physical therapy. But the damage on the radiographs just seem a little too aggressive. So it looks like the fentanyl patch probably wouldn't help too much. The intra-articular glucocorticoid injections could be used to reduce the inflammation, but I still don't think that that's the best choice in our patient. Walking aids, I feel like the walking aids would only decrease the amount of movement that this patient could have on their own, and it's not really going to help with the actual symptoms at hand. And then E, arthroscopic hip debridement. This could be helpful because the radiographs does show severe osteoarthritis of the left hip, and concerning his worsening symptoms. And if we read this line in the vignette, he does ask for a treatment that will lead to long-term improvement of his symptoms. So an arthroscopic hip debridement could help, and a total hip arthroplasty could also help. And he's 61 years old, so he does still have like quality of life is important. So I'm going to go with the total hip arthroplasty because he's had inadequate relief, as it says here. The conservative measures did not work, and his daily life and quality of living is being impacted. So let's move on.